You have been asked to watch this brief presentation to give you some important background information before your genetics consultation in order to help your visit go more smoothly and quickly. The presentation will provide information regarding the basics of genetic carrier screening, as well as a brief review of some billing information related to your visit. Once you have finished watching this presentation, you will meet with a genetic counselor. If you decide to have any carrier screening performed today, you will have your blood drawn as well. As you may know, most babies are born healthy and without genetic disorders. In some cases, we can determine whether or not a baby is at increased risk for a genetic disorder based on family history. However, for many genetic disorders, babies can be at increased risk even if there is no family history. Carrier screening is a blood test that is designed to determine if you or your partner carry certain changes in your genes that could cause an inherited disorder to be passed down to your children. Carrier screening is mainly designed to help determine the risk to a pregnancy for genetic disorders inherited in an autosomal recessive manner. This means that both a mother and a father must be carriers of the same genetic disorder in order for their children to be at risk. Studies have shown that all people, regardless of ethnic background, are carriers of 8 to 10 autosomal recessive genetic disorders. If two parents are both carriers of the same disorder, each of their children has a 25% chance of inheriting that genetic disorder. Most babies born with one of these autosomal recessive disorders have no family history of the disorder, so we cannot rely on family history to determine which babies are at risk. Therefore, carrier screening for over 70 disorders is offered to all couples. All of these conditions affect a child's quality of life, life expectancy, and/or have limited treatment options. Most of these conditions can cause intellectual disability or structural birth defects. Women who choose to have carrier screening will also typically have screening for a disorder called Fragile X syndrome. This disorder is a relatively common cause of intellectual disability and typically affects males, although females can sometimes have this disorder as well. Fragile X syndrome is not inherited in the same way as the autosomal recessive disorders discussed previously. Instead, it is typically passed from carrier mothers to their sons. Approximately 1 in 200 women carry Fragile X syndrome. The results of Fragile X syndrome carrier screening can have implications not only for the health of your baby, but also for a carrier woman and her other adult family members. Your genetic counselor will provide you with additional information and details about all of your screening options, and will be able to answer any questions you may have regarding the information in this presentation. We want to emphasize that, in the majority of cases, the results of any screening you choose to have today will provide reassurance. Most people will learn that they have a low risk for the genetic conditions for which they are being screened. If an increased risk is detected, your genetic counselor will help you to understand these risks and make decisions regarding possible further evaluation of the pregnancy. The last few minutes of this presentation will review some important information regarding billing for your genetics visit and testing. Insight Medical Genetics is made up of two entities functioning seamlessly together: Insight Medical Genetics, LLC, which provides our laboratory services, and IMG MD, LLC, which provides our clinical and physician services. While all of the major health plans recognize Insight Medical Genetics as a participating provider, we may not be an in-network provider for your specific health plan. We encourage you to speak with our financial counselor to discuss whether or not IMG is in-network for your plan, as well as any other questions you have regarding insurance. We will bill your insurance directly for all of our services, and you will be responsible for any deductible, copay, and co-insurance that is determined by your health plan. After we bill your insurance carrier, your health plan may then send you an explanation of benefits, EOB, An EOB is not a bill. It is a statement of covered services when the claim is first submitted to your insurance carrier and is not a final reflection of your charges. If you receive an EOB and have a question, please contact us, not your referring physician. Insight Medical Genetics is committed to providing the highest quality of care to all of our patients. We understand and appreciate that the costs of providing high-quality, specialized genetic testing can be substantial. At Insight, we believe in providing these services in such a way that the cost to you will be minimized, and therefore we have developed the IMG Patient Access Care Program to assist our patients with the billing process. The IMG Patient Access Care Program is designed to aid individuals with financial challenges, including those who are not insured or are underinsured. If you have questions or would like to discuss the IMG Patient Access Care Program, please ask to speak with our financial counselor. Thank you for taking the time to learn about prenatal screening prior to your genetic counseling session. We hope that the information in this presentation will serve as a starting point for your discussion with your genetic counselor and physician. Please don't hesitate to ask any questions you have regarding this presentation as you discuss your options and next steps with us. Thank you for allowing us to assist you in your care.